Assalamu-Alaikum everyone. Welcome back to my channel. I am Dr. Naeem, and today we are talking about one of the most important vitamins in your body, vitamin D. A deficiency of vitamin D can cause bone pain, tiredness, mood problems, weak immunity, and many long-term health issues. So in this video, we'll cover: what is vitamin D? Types of vitamin D. Its important functions. Deficiency signs and symptoms. Blood levels and diagnosis. Treatment and supplements. Food sources. Sunlight exposure. Common myths. Make sure you watch till the end. What is vitamin D? Vitamin D is known as the sunshine vitamin because your skin makes it when exposed to sunlight. It acts like a hormone in the body and is essential for calcium absorption, bone strength, immune system function, muscle health, brain and mood regulation. Unlike other vitamins, vitamin D is not present in many foods, which is why deficiency is extremely common. Types of vitamin D. There are two main types. Vitamin D2, ergocalciferol. Found in plant-based sources, mushrooms, fortified foods. Less potent. Shorter duration of action. Vitamin D3, cholecalciferol. Produced in your skin when exposed to sunlight. Found in animal sources, fish, eggs, dairy. More powerful and long-lasting. Preferred form for supplements. Most doctors recommend vitamin D3 because it raises blood levels more effectively. Functions of vitamin D. Vitamin D plays roles in nearly every system of your body. Bones and teeth. Helps calcium absorption and prevents weak bones. Muscles. Improves strength and prevents muscle cramps. Immune system. Reduces risk of infections, including viral infections. Brain and mood. Low vitamin D is linked with depression and mood swings. Heart health. Supports normal blood pressure and reduces inflammation. Cell growth. Important for normal growth in children. Causes of vitamin D deficiency. You may be deficient due to not enough sun exposure, living in cold countries, indoor lifestyle, using sunscreen all the time, darker skin tones, aging, kidney or liver disease, poor diet, malabsorption disorders, IBD, celiac disease. Signs and symptoms of vitamin D deficiency. Common symptoms include bone pain, muscle weakness, tiredness, fatigue, body aches, leg cramps, low mood, depression, poor sleep, frequent infections, numbness or tingling. In children, delayed growth, bowed legs. Long-term severe deficiency can lead to osteomalacia, soft bones in adults. Rickets, children. Osteoporosis. Increased fracture risk. 1000 to 2000 IU vitamin D3 for general health. 2000 to 4000 IU for deficiency prevention. High dose plan, doctor supervised. 20,000 IU weekly. OR 50,000 IU weekly. OR loading dose of 300,000 IU over several weeks. Never take high doses without medical supervision. Calcium together? If your calcium is low, your doctor may recommend vitamin D plus calcium combination. Diagnosis: vitamin D blood test. A simple blood test called 25-hydroxy vitamin D, 25-OH vitamin D, is used. Normal range, 75 to 115 mol/tel. Insufficient, 50 to 75 mol/tel. Deficient, less than 15 mol/tel. Severe deficiency, an LT, 25 mol/tel. Food sources of vitamin D. Vitamin D-rich foods include oily fish, salmon, mackerel, sardines, egg yolks, fortified milk and yogurt, cheese, mushrooms, especially sun-exposed, cod liver oil, richest natural source. But food alone usually cannot meet daily vitamin D requirements. Sunlight and vitamin D. To boost vitamin D naturally. Get 10 to 20 minutes of sunlight on arms, face 3 to 4 times a week. Best time, 10 a.m. to 3 p.m. Cloudy weather, winter season, and dark skin require longer exposure. Sunscreen reduces vitamin D production. Clothing also blocks UV rays. But always balance with skin protection. Myths about vitamin D. Myth 1, only sunlight is enough. Reality, most people still remain deficient. Myth 2, multivitamins provide enough vitamin D. Reality, they usually have very low doses. Myth 3, dark skin protects against deficiency. Reality, darker skin needs more sunlight. Myth 4, you only need vitamin D in winter. Reality, you need it all year round.
Absorbed through sunlight is crucial for bone health. It helps your bones absorb calcium, keeping them strong and healthy.
Vitamin D is essential for your bones, muscles, immunity, and overall health. If you feel tired, weak, or have bone pain, get your blood test and consider supplements. Stay healthy, stay strong. I am Dr. Naeem. See you in the next video.